having an overbite is a very common problem in our culture and our population in North America, and in certain other populations, people are going to be more prone to having an underbite, or their lower jaw is going to stick out relative to their upper jaw. So this is what most people would consider an underbite. So their lower jaw is out past their upper jaw there. And that's a little bit harder to correct. Now, in the population that we typically see here in the United States, the majority of people with bite issues have an overbite. And an overbite is when the top teeth stick out a little bit relative to the bottom teeth. So today I'm going to talk a little bit about what causes this overbite and what are some solutions and treatments. The number one cause of the overbite is genetics. So it's the genes that you got from mom and dad and grandma and grandpa. They have an overbite, so you have an overbite as well. Now there are two underlying reasons for having an overbite. I'm talking about the genetic component here. Number one is if your upper jaw is too developed relative to your lower jaw. So your upper jaw sticks out too far. Now this is very uncommon, and you hardly ever see that. Usually the most common cause of having the overbite is your lower jaw being underdeveloped. And you see that when you look at people from the side, look at their profile shots. Some people have a really convex facial profile, so their lower jaw is just set back a little bit, and that's just purely a genetic thing. You just get that from your parents. So how do we correct that? What's the best way to correct a skeletal problem or a skeletal imbalance? Now years ago it was a lot more popular to use headgear to fix large overbite problems. I don't like to use headgear, and I'll explain why. The way headgear works, headgear attaches to the braces in the very back of the upper teeth there. And what it does is it pulls back that upper jaw. But if you remember, we just discussed that usually the problem is not in the upper jaw. Usually the upper jaw is fine. Usually the reason you have an overbite is because the lower jaw is set back or retruded. So if you're using headgear to fix an overbite, typically what you're doing is you're causing the upper jaw to match that lower jaw, which is retruded. So now your teeth fit together, but you have a retruded upper jaw and a retruded lower jaw, which doesn't look very nice aesthetically. You have a very flat facial appearance, and you almost get that look of someone that has fake teeth and take their dentures out. So we don't often use headgear, and that's where it's very important to diagnose where the problem is. So what we want to do to correct this problem is to encourage the lower jaw to grow and to grow and to match that upper jaw. And so in orthodontics, timing is really important because we can encourage growth of the lower jaw. It's hard to make the jaw grow more than it necessarily would genetically, but timing-wise, we can guide things and remodel the bones to help maximize that growth potential. And we do that in a number of ways. So the question is, when is the best time to do this and correct this? Usually it's right before girls and guys hit their peak growth spurt. So right before 11 to 10, 11 years old with girls, 11, 12, 13 with guys, right before they're going through a lot of those secondary changes is when we like to see them, because that's when they're going to hit that peak growth spurt, and that's when their jaws are going to grow, and more importantly, that's when their lower jaw is going to grow the most. So that's when we can actually change that the most. So we do that a couple of different ways. One way is just by using elastics. I don't know if you can see that. They're actually really small, and if you're familiar at all with braces, you've probably seen these before. So elastics, they just attach depending on which way we want the jaws and the teeth to move from the bottom brackets to the top brackets, or vice versa. And what that does is that lets that upper jaw come out and the lower jaw go in, or in the cases where we have the overbite, we would do the opposite, and we would want that lower jaw to come out a little bit and that upper jaw to come in. Actually moves the teeth a little bit as well. And we use elastics a lot in cases that aren't too severe. If cases are severe, we have other things that we use to help guide that jaw grow. Now this would be an example of an appliance that we use in someone who has a severe jaw discrepancy. So someone who has a big overbite, whose lower jaw is set back quite far. So it's a spring that sets inside the mouth, inside the cheeks, and I always tell people it probably looks a lot scarier than it actually ends up being. Most people, we put this in, they get used to it in a couple of days. You can't even tell you have it in. It allows you to chew and open and close, very normally. But the advantage over elastics that the spring has is that it's constantly working, and it puts the constant amount of force on there, 24 hours a day. And actually, that opening and closing motion is gonna put a little bit more force on the teeth, and it's gonna let the lower jaw go into that better position, and it's going to help that growth there. So this is a Forces appliance, and then we use that again in severe overbite cases. Cases where you could probably stick your whole thumb right in between your upper and lower jaw there. So if you are in that category, you may be a candidate for this appliance. And the nice thing is it speeds up treatment quite a bit relative to just wearing the elastic. So even if you have a severe overbite and you feel like your teeth are sticking out very far, it doesn't mean your case is going to necessarily take any longer than a normal case was, because we're using technology like this. Now, another reason you may have an overbite is because of a habit, or just because your teeth are sticking out a little bit farther relative to your bottom teeth. So you may have a normal jaw relationship, but your upper teeth may stick out relative to your lower teeth, and that could just be the position that they came in. You may be a thumb sucker, or have used a pacifier when you were younger. Those cases are a lot quicker and easier to fix because we're not having to remodel and guide the jaws. We're just actually fixing the teeth and bringing them back into a proper position. So those are fairly quick and relatively easy cases in the orthodontic world to fix.